welcome back to my channel. Today we are going to talk about the all-important journey and that transition from home to either hospital or birthing centre. And while we do so much preparation, particularly as first-time mums, when it comes to meeting our baby, managing our surges, what to do if our waters go, and particularly after meeting our baby, creating our nursery and things like that, that many of us neglect to prepare for that all-important transition where things might be going really smoothly and absolutely beautifully at home. The transition and actually getting into a car and going from home to hospital environment can be quite jarring. So I hope that you can get some tips and little ideas for how you can make that transition and that journey a little bit more comfortable for you. If there are some tips and ideas that you have used previously that worked really well that I haven't shared in this video, do make sure and add them into the comment section down below. I hope you find this video helpful. So let's dive straight into the tips. And my tip number one is both to practice and time your route. So when it comes down to it, to getting into the car, things are moving quite well, you think you're progressing really beautifully. What happens a lot of times is that an argument will ensue over, we'll go left because there's less traffic lights, and well, right, there's more ramps. And having that debate when you're in the middle of birthing your baby or in the middle of labour is not going to help things. So maybe doing a practice run when you're on your way to one of your antenatal appointments with your partner in tow and knowing where you're going to park. Do you have change for the parking lot? Do you have an idea of what map you are going to follow, or you're just going to Google Maps it? How long does it take? Little things like that sound really silly, but when it comes down to that journey itself, can be really, really beneficial. So practice the journey, know what route you're going to take, and try and figure out how long it's going to take you. My tip number two is make your nest. So we talk about this a lot in hypnobirthing. We talk about how your psychology impacts your physiology, and making a space that feels cozy, comfortable, maybe a little bit more private on that hospital journey can make things run a lot more smoothly and be a lot more comfortable than you would imagine. So you're thinking about packing a pregnancy pillow, maybe pillow from home, a nice cozy blanket, laying down maybe some of the plastic lined sheets or pet sheets. If you go to sort of your nearest pound shop, Euro shop, and get some of the puppy training pads, you can lay the bottom of the car with the bottom of the seat with that. Thinking about where you are going to be in terms of your position as well. So thinking about if you're going to be in the front seat with your partner, whether you want the comfort and reassurance of their voice. So you might want in that case to push that passenger seat right back as far as it will go, so that you can be kind of up on your knees, leaning against the head of the seat itself. Or you might in fact want to create your little nest in the back seat altogether, so laying out those puppy pads, maybe wearing, in case your waters go or if they've already gone, maybe wearing one of those Tena pads already, so that you don't have to be worrying about that, or towels even will do, laying the floor and the seats with those. But creating that space, that little nook for you to be in, means that it's going to be a much more comfortable journey for you, and you can actually leave those things for your nest in the back of your car as you're kind of reaching your due date. So my next tip might come as an obvious one for a lot of you, and that is sound. So whether it's your hypnobirthing tracks, which if you haven't thought about it already, please do consider downloading and looking at my e-course that's going to teach you how to birth almost pain-free and using those techniques. Or if it's music, maybe, that is more your jam, thinking about creating that playlist and how you're going to listen to it during that journey. So it might be the use of the speaker itself, and which both you and whoever else is in the car during that time will be immersed in that experience together, and you'll be able to sort of coach one another. Or it might be the use of sort of little headphones, in which case I would say go for the AirPods, something that is wireless, is less finicky, less fiddly, one less thing to think about, and you'll be able to kind of move as freely as you can do within a car space. But music can be really, really powerful, and hypnobirthing in particular can really speak to any of those fears or concerns that you might already be mulling over in your mind. So without diving too deeply into hypnobirthing and what that is, in essence, it's about looking how your psychology impacts your physiology and looking at how you can truly hack your hormones for birth. And one of those hormones is melatonin. And melatonin is a labor helper, it's a birth helper, and it works best and is sort of most easily flowing when you are in a quiet, private, dark, in particular, space. So it's also the oxytocin helper, which of course is, we cannot have those lovely powerful surges that bring our baby earthside without the use of oxytocin. So when we think about what we can do to help those two hormones flow really nicely, we want to look at our environment. So you might want to go in the style of a face mask, a sleep mask, an eye mask, a nice comfortable one that you would be quite used to for the journey itself, and then lying maybe on your left lateral in the back. Or you might think about wearing celebrity style, VIP style wraparound sunglasses. And many of my mums will actually wear these for the duration of their birthing experience. And what that does is it works to create that dim lighting, that dim atmosphere that means that our body is going to produce that beautiful oxytocin and melatonin, which are going to work to create a really beautiful, comfortable birthing experience. So it's worthwhile considering one of those two avenues. So an eye mask, or indeed a VIP style wraparound sunglasses for that journey. So my next tip is the use of a TENS machine. And while you might not have heard of this before, a TENS machine is a little device that has 4 sticky pads, 2 that go above the knicker line and 2 that go below the bra line. Of course, you can adjust these depending on where you are feeling the intensity of your surges, but the idea is that it works in 2 main ways. In fact, I love it so much that I've created an entire YouTube video dedicated to its use. So I'll make sure and link that in the cards of this video down below. But it works in 2 main ways. A, it works to sort of block that that pain nerve pathway, running on the science behind it that only one sensation can be met at any one time or felt at any one time. So it interferes with that nerve sensation by giving you a continuous stimulation of that kind of electrical impulse over your back area. It also works in another way by helping you to release more of your natural pain relievers, those endorphins, which give us that burst of that feel-good factor as well as relieving pain from the sensation of those surges. So try out the TENS machine. It's something that you can use yourself and have complete control over, whether you are the person in the front seat or whether you're in the back seat. When you are not driving, it's something that's completely safe for you to use. So give it a go now and see how you get on. So my next tip is to try out combs. And this is something that I've only really come across in the last maybe year as working really nicely. And again, similar to the TENS machine, it's got sort of 2 modes of pain relief. The first one is that you apply 2 combs, so facing sort of teeth down, directly into the midline of your palm, so that palmar crease, and you hold on to them at the peak, at the crest of that wave of your surge. So just as a little reminder, your surge will come just peaking like a wave and then ebbs away. And at the crest of that wave, that is where you want to be applying your comfort measures. So that whether that's acupressure, massage, counter pressure, in this case, you're talking about holding down on your combs and applying that pressure to the midline of your palm. So 2 combs means that A, you're getting the benefit of that gorgeous acupressure, but also what's happening is that your body is only able to process one sensation at a time, and the fact that you're holding on to both of these combs just above your uterus means that it's more likely to process that sensation than it is over the intensity of your surges. So make sure and give that a go and let me know how you get on in the comment section down below in this video. So my next tip is a really obvious one, but it's something that you might want to come back to when you're talking about that first idea when it comes to creating your journey, and that is to avoid bumps. When it comes to having a journey that is going sort of quite smoothly, tootling along. You can get there a lot faster, but when it comes to ramps and bumps in the road, you want to make sure that you have plenty of space to slow down over them. So whether that means taking your journey that little bit slower so that you have the capacity to go slowly over them, leaving in plenty of time if you know that you have got lots of bumps in the road to go over, they can be a lot more intense for mamas who are labouring. So just bearing those in mind and maybe seeing if you can either create a journey where you can avoid them, if at all possible, or that you make sure that you leave in plenty of time that you can go nice and slowly over them. So my last and 10th tip is honestly a whole video all in itself, but that is, what if baby's coming really fast? And while that might be quite uncommon for first time mum, it certainly is not unheard of, and particularly if you've had a baby before. So when it comes to birthing our babies, our cervix is not a crystal ball. It does not mean that it's going to go at 1 centimeter per hour, and sometimes our body just knows exactly what to do. If mama feels that urge to push, that urge to bear down, and things are moving quite fast and furious, the first thing that you want to do is put your hazard lights on and to pull in safely at the side of the road. Call your emergency line, let them know where you are, what exactly is happening, and they will talk you through the rest of the scenario. As mum births her baby, she's very capable of catching her baby herself, but making sure that there is a soft landing for baby, whether that's just a jacket, whether it's birthing up on the back seat of the car, so there's somewhere safe for your baby to land if for some reason baby wasn't to be caught nice and safely. And then after that, you're talking about keeping baby attached to mum. So there is absolutely no reason for you to go poking and prodding at the cord at this point. Allow all of that gorgeous red, sort of nutrient rich blood flow to go from the placenta to baby, keeping them attached and keeping them up, maybe tucked underneath mummy's jumper or shirt, and then another layer over baby to keep them nice and snug and warm, until such time as your paramedic team arrive. But that is just it in a nutshell. I hope that you found these ideas helpful, and I hope that if you are expecting your baby soon, that you're able to utilize some of these ideas on that journey for yourself. Let me know if you've tried them out, and I hope you found this video helpful. I will see you in the next one.